The yellow is, I think, the treatment and the evaluation and treatment from the spine specialist. And, she was having symptoms, again, left worse than right, some right leg pain. Said it started spontaneously. Again, there was no history that I would call back pain. And talked about it radiating, which is, again, quite typical of spine problems in my experience. And it was intermittent, which can be either. Could be either due to spine or circulatory problems. And activities with walking, that can be vascular, but of course the spinal stenosis also causes pain with walking. Anyway, they felt that their thought was this is most likely a back problem, and they ordered an MRI of the spine, which is typical imaging they could look for pathology in the spine that might explain these types of symptoms. So,
and
all of that was reasonable in terms of what they did.
Yes. Did you review the MRI that Mrs. Beber had of her low back?
I reviewed the report. I'm not a spine surgeon, and I wouldn't even pretend to tell you I know how to read MRIs myself. But I reviewed the report, and it did show some evidence of arthritis of the spine, I think some protrusion of discs and so forth.
All right. Now, what is your understanding as to how Mrs. Beber got to the Back Institute?
She was referred by Dr. Metzger's office.
Who in Dr. Metzger's office referred Mrs. Beber to the Back Institute?
I believe it was the nurse, Ms. Dobson, I believe her name.
Hobson.
Hobson?
Yes.
Hobson, pardon me.
That's okay. And, all right, so we move forward in the timeline, and when is it that it becomes crystal clear to you that she has...
So she had the MRI, and they embarked on a treatment that's often done for people with spinal arthritis of having cortisone injections in the back. I believe the particular one she had was an epidural injection. She had one, seemed to get a little bit better, and which was noted on, I think, February 27th. Although, I guess to other people she had said that they never helped, but it said on the 27th, and this was the physician's assistant who was actually managing her treatment at that point.
Let me stop there for a moment.
Yes.
Did any physician see Mrs. Beber when she was referred to the Back Institute on February 13, 2008?
I couldn't see any evidence in the record that the spine surgeon had seen or evaluated the patient. It seemed to me that Mr. Howell, I believe was his name, was the physician's assistant, was managing the patient more or less independently.
All right.
So she had a cortisone injection, seemed to get a little bit better, but was still having quite a bit of pain in the leg. And on the 3rd, asked for a refill of her hydrocodone, which is Vicodin. And then on the 4th, she was, I believe she called the office. She saw Dr. Metzger, I believe, on the 4th, complaining of continued pain, numbness in the leg, in the left leg. She's now had 2 epidural injections. She's not getting better. And her symptoms had changed in the sense that she was walking much shorter distances than she was able to before. And the pain now was localized mostly in the lower leg, the calf and shin area, into the foot. So this is the point where I would start getting concerned that things are not what they appear to be. She's had 2 cortisone injections in a relatively short period of time, I believe about a week apart, and she's not better, she's worse. And the expectation should be that she would be improving after those injections if they had the right diagnosis. So here is where I get concerned that something has changed. Her symptoms changed, they've gotten worse, she's having a lot of difficulty walking.
This is when you say here, you mean March 4, 2008?
March 4th, yes.
All right. Now, prior to March 4, 2008, is it your opinion that she was having signs and symptoms consistent with a vascular problem, but she was also having signs and symptoms that may be consistent with a back problem?
Yes.
In other words, she had some overlapping symptoms.
Could be either or.
All right. And why is it important for a doctor to consider both?
Objection, Your Honor. It's cumulative Dr. Santana's testimony. Oh, no.
So, as we talked about earlier, we don't always have the right diagnosis, and the implications of being wrong about a severe circulatory problem are bad. As happened in this case, the lady lost her leg. So, if treatment isn't working, and you're thinking about vascular disease as the other possible diagnosis, at this point, I think if it was me, what I would say is, I have the wrong diagnosis. Let's have a different specialist, a vascular specialist, a vascular surgeon in this case, evaluate the patient and see what their opinion is.